morning, everybody. First, I would like to apologize. I have a common cold, so if my voice is not clear, please forgive me. So we're continuing about the special or difficult cases in CI, and my talk today about the children with Jervell Lange syndrome or JLN syndrome. When they going to do CI, what we need to know and what we need, the actions we have to do. First, this is a screenshot from one of the social group on the Facebook. You know, the families of the children usually make groups where they exchange their experience. And in this post was in 2019, talking about the area where most of our patients come from in Sohag University CI Center in Luxor and Aswan. And one of the mother reported that she reported 14 cases, which most of them died after dead CI or at least have a cardiac problem. And they starting to discuss this, is this a link between CI and death of the children? And some of said it's maybe related to the operations, and some doctors even went to this post and committed to explain the wrong information, which sometimes spread by the parents. So I will show quickly two cases, examples of these children with JLN syndrome. Yassine, he's a 2.5 years old child from Luxor, Aswan, referred to Sohag University CI Center as a candidate for CI. And from the history, the mother reported that there was a syncopal attack twice at age of 4 months and at age of 7 months. And the mother went to Magdi Yaqub Heart Center. This is an eminent center in south of Egypt, where the child had intracardio defibrillator implantation, which is the implantation in the heart make a shock when the child heart stop or arrested. This defibrillator give immediate electric shock to the heart, so the heart can return pumping again. Also, in the family history, the mother reported that she had another child who had a sudden, he was also deaf, and he had a sudden death at age of 5 years. So what's the action we did in our centers before doing this child? The first action, we contact Aswan Heart Center to get 3 important reports for us. The report 1 is about the operation which done to the child, the details of the operation. We need also information about the safety of doing the CI surgery for the child, because this was the first case to do this case in our center. This was like about 8 years ago. And get the clearance from them to do the surgery. And the third report, their advice about any precautions, either pre or intra or post-operative. They was very cooperative in Aswan Center, in Magdi Yaqub Center, and they sent us all the details we need. They sent us a report about the operation date, a report about the device implanted, and also the precautions and the drugs that we need to avoid either pre or intra-operative. And also if there's a changes in the medications that child should be done during the surgery period. And the second action, we inside the hospital, after we getting all the information of the for this child, we get the approval of the anesthesia doctors after discovering his heart condition, and get approval that he's fit for the surgery. We get consultations from the pediatric cardiologist who assess the child and prepared for intraoperative also monitoring, and also to follow up the child post-operatively and get a place in the PICU, because mostly the first night should be, the child should be post-operatively admitted to the pediatric ICU. Also, we have a consultation of the surgeon that you have to avoid the monocerebral diathermy. The same like if the child have CI, he has an implant, so we cannot use a monocerebral diathermy. And also special precautions, which for us as an audiologist, during the switch on, and this I'm going to discuss in details. And also a good counseling for the parents about the situation and or precautions post-operatively. The results, everything went very well, pre-operative and intraoperative, and the child recovered normally, and he stayed 6 hours in the PICU, and everything was okay. But he stayed 3 days in the hospital post-operatively, and the mother reported that he had twice cardiac arrest, and most of the time the child was those twice happened when the child sees the nurses coming, because he's afraid from the shots, the antibiotic shots, so he get afraid and then he get arrested. But fortunately, he had his implants, the cardiac implant, so his heart returned normally. The second case, this is another case which we already did in Sohag University CI Center at age of 3 years, and during her follow-up post-operatively, like after we finished the CI fitting and her regular follow-up, the mother reported that the girl have syncope attacks or fainting attacks in school many times, and she went to pediatrician who referred her to a neurologist who did the routine investigation. And this is actually the first red flag you have to take care of when you have a syncopal attack with a child with sensory hearing loss. And this usually is the scenario which usually happens with those children. They go to the pediatrician, then the pediatrician refers them to a cardiologist, to a neurologist, I'm sorry, and mostly they diagnose them as an epilepsy and they give them anti-epileptic drugs. Or sometimes when they did the lab work and find that anemia, because the JLN syndromes also have iron deficiency anemia, so they explain their fainting due to the anemia or due to the epilepsy. Actually, we did an ECG for this girl, and we found that she already have a prolonged QT interval. She's a JLN syndrome. So we referred her to Aswan Heart Center. Also, her younger child was in our waiting list to do CI, so we referred them both to Aswan Center. They did the investigation there, and they also confirmed the diagnosis of JLN, but they confirmed that they don't need the mild form and they don't need implantation. They just need an Indral or propranolol or beta blocker medications, and the child, we implanted the child and he gone very well. So quickly, 2 minutes, I will discuss the JLN syndrome. It's an autosomal recessive syndrome characterized by bilateral sensory hearing loss, a prolonged QT interval, and the cut point here is 500 milliseconds. It's usually the history is a syncopal attack, fainting spells due to sudden cardiac arrest, and in most of the time the cardiac is return pumping spontaneously, but sometimes it's not returned, and this causes a sudden death. And of course, in ECG, they have a prolonged QT interval. The etiology, there are 2 genes which are responsible for JLN. The first gene is KCNQ1, which is 90% of the case, and this is the mild form. And the second gene is only presenting 10%, and actually this is a severe form of the disease. The cause, this gene is responsible for the potassium channel in heart and cochlea, and this explains the relation between the hearing loss and the heart in this case. This is the difference between the normal ECG and the long QT interval, and it's clear the difference between both in ECG. Epidemiology is different from different countries. Sometimes in India, they said it's about 5% of the children going for CI having JLN syndrome. Quickly, I'm going to go for what we important for us is the switching on for the external device. We need to know to do it in hospital, avoid to do it in clinic, because
your time is up.